Hi, this is Annie Thoe and welcome to Sensing Vitality. Today I have a wonderful lesson for knee pain to help improve how you align yourself, how you stand, how you sit, how you walk, so that if you're having constant swelling or pain in your knee, hopefully that can really clear out with better alignment and better movement. It's a pretty amazing lesson, so stay tuned. So what you're going to need is a flat chair or bench that has a nice 90-degree height for you ultimately, or you can get a piece of plywood and put that on something that is squishy so it's firm. You need something firm to sit on that's flat. Okay, you're going to need a blanket roll and bare feet preferably. It's much better. Shoes are like a natural orthotic. They hold your movement patterns, and after this lesson, when you put your shoes on, if your feet or your knees hurt, you might need a new pair of shoes, and as you improve your alignment, your shoes will hold the alignment you have. Okay, so we're going to start first with knee problems, knee pain, is by feeling your sit bones really clearly, because when the pelvis is really nicely aligned, a lot of knee problems clear very quickly. So you're going to find your sit bone, and to do that I'm turning so you can see. I'm going to take the tips of my fingers and just mostly my middle finger and lean my weight onto the tip of that finger just to the outer perimeter of my sit bone, the periphery. Okay, so you're going to start, I'll face you, you're going to start at the top and just lean on the tip of the finger and then come off, and then move the finger a little bit, lean, and then come off. Move the finger, lean, feel the bone with the fingertip, come off, and then go to the crack of your butt and see, can you feel the sit bone from there, and come off, and then maybe from the inside of the leg. Of course you wouldn't do this in public, but at home you can do this. So around we go. Let's do it one more time. So taking the tip of the finger, leaning, and you can kind of even squirm around a little bit to find that bone, working along the tip. And we can spend a lot longer. I have a whole lesson devoted to this, but just to really sensitize, get your brain to feel that bone. You'll see the difference in a moment. Take away your hand and now sense that right side of your butt. Can you feel the bone if you lean on it compared to the left? And then tap your heel. And we're going to do something special today. You're going to take your fingertip and point it straight down over the heel. So the heel should be right under the knee. These ankle bones should be right under the knee. And tap with the fingertip moving up and down like a sewing needle in a sewing machine. Okay? Moving up and down. All right. Now, let's try the other sit bone. So take your fingertips to the top and lean into those fingertips and just feel the contact of your fingers. Now, believe it or not, I had some technical difficulties and I have done this now lesson 3 times and my sitting bones are so clear. So if you have never done this before, repeat this part a number of times and that sitting bone will really pop out for you in a sensory way. So make sure you come through the front, feeling the sit bone. It's shocking how big it is. It's quite large. And that's because it's supporting the entire weight of your upper body. Okay, so can you feel the left sitting bone or your right, depending on which one you're using? Can you feel that sitting bone and then feel the other one? Take your finger now and point and let it push down a little bit into the heel so the knee is driving straight down over the heel. Now we're not going to worry what part of the heel yet. This is just generally to feel the heel bone today. Okay? Now, Can you feel both sitting bones, and can you feel the heel bones? And they hopefully will sound with the same thump. That's a long-term goal. Okay, now let's sit on the roll. All right, so we felt the sitting bones, now we've got the roller. The roller is very different in that we're feeling a different part of the pelvis now, the insides of the sitting bones, and it has this watershed effect of dividing the weight more evenly between the two sides. Now, take your index finger and point it toward that heel and press, or just plop the heel, you don't even need to press, plop the heel and sense the bone from the finger, right? So it's straight up and down. Now try it with the other heel. Straight up and down. Straight up and down. Tapping the heel. All right, now let's take away the roll and feel your sit bones after being on the roll. The roller itself really clears up a lot of knee trouble because it helps balance the pelvis on top of the feet. All right, but today we're really fine-tuning the knees with this. Take your finger like a laser beam needle and going now through the heel, tapping, 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 tapping. Should be clearer now to feel the heel and the sit bone. So if you rock forward and back, can you tap while you rock and keep that finger straight? Same thing on this side, rock forward and back and tapping the heel. All right, now let's hop on this again. And now it's going to get more advanced. So if you're a skier, this is the lesson for you. This will really smooth out your skiing and really protect your knees. Okay, so now you're going to put your finger on top of your knee and tap, but slowly take your pelvis across while you tap. All right, and then come back and roll the other way, but keep that finger straight aligned so it's not tilting right or left or forward or back. It's staying straight up in the air and going down, down. As I move my pelvis, my knee is right over my heel. Okay? This is a lot like walking or hiking or running or any sport that we might be doing those in. Same thing with the other side. So you're going to take your finger, point straight down to the heel, tap a few times, and then you're going to roll your pelvis side to side while you point your finger through the heel bone. Just like you're sewing, doom, 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 and the pelvis goes side to side, and try to relax, breathe, relax your chest. Good. And then let's sit. And how does that feel now on the sit bones? You should really feel the bones now, and the musculature should be much lighter just from sitting on the roll, but also doing this amazing little movement. Now, take your finger once again straight on top of that knee and tap your heel. But this time, shift your weight. So you put your weight on that right sitting bone as you tap your knee up and down, and then transfer so you've got the weight on the left sitting bone. So you keep tapping with the knee straight on top of the heel and move your pelvis from one side back to the other. Okay, I'm going pretty fast actually. I could do this slower. Let's do the next one a little slower. So point your finger down, tap first, and let's go slower this time. Slower. And you shift your weight to the other hip, the other sitting bone, and slowly come back. Make sure your finger is straight up as you tap. Straight up as you tap. And then the chest is relaxed. That's it. Okay, pretty good. All right, here's the final challenge. Take the roll underneath you and get comfortable. So, if you've ever skied down a mountain with your eyes closed, or part of a mountain, that is the ultimate test for balance. So right now what we're going to do is sort of do an imaginary slalom down the mountain. You're going to take your finger and make sure it's straight up and down. Tap and look right now. And then I want you to look at the horizon, but keep your finger. Just look down now and then and check. So your head is upright, but your finger is straight up and down. So you really have to reach that arm to do that. Now close your eyes and slowly tilt your pelvis, but keep your fingers straight up and down. Keep breathing. And then roll to the other side. Keep your fingers straight up and down. And do that one more time. Keep breathing. And then come back. So other finger. Look at it first. Make sure it's straight up and down. Really reach your arm so that that finger is straight. And eyes at the horizon. And now close your eyes. And be careful. My fingers, I can tell, not perfect on this side. So I'm going to go a little slower. Tap, tap. And my pelvis is shifting from side to side. And then I'll come back to the middle. All right, take away the roll. All right, now notice how your heels feel and the pelvis. Can you sense the contact of the bones? And let's see if you can do that last thing we did on the roll, sitting, but really be careful your fingers straight like a sewing needle, straight up and down as the heel's thumping, and you're going to shift with your eyes closed from one sitting bone on top of the other. Oh, there I shifted a little. So be careful that your fingers straight up and down, eyes closed, and you can always open your eyes and check. You can do this lesson many times. Other side. Shifting. So up and down with the finger in the heel. That's it. The finger is just resting on top. It's not having to push, but having good firm contact so you can feel the heel through the fingertip. As you roll your pelvis from one sitting bone to the other. All right, now roll your pelvis forward and back, and you should really feel this straight alignment, okay? Forward and back alignment so that when you come up, the heels are right there and the knees are just relaxed. When you sit down, same thing. So it should be really easy to come up and down. So this lesson, if you practice this with some of my other knee lessons, should really help your alignment with your knees and clear up so many knee issues. Even if you have arthritis, this is fabulous. All right, thanks for joining me. Thanks for being on this channel. I appreciate all your comments, and stay tuned for more. Take care.